earlier today, we had a section at Faji where we discussed a brief about, these issues that affect us as young people, as women, as girls. And I believe, reproductive health issues are not just limited to one person alone, and generally, in as much as we are living, we are breathing, we are existing, and we go about our daily life activities, we need to be sound health wise. So, on this episode of our Chat for Health segment, we'll be discussing a lot of issues. So, please, we'll enjoin you to stay with us, and then make sure you drop your questions. And we have our doctors and in the house, our experts who are going to be attending to all of those health issues that we have, and then we get the needed you know informations that will guide us through keeping our health healthy enough. All right, so as we proceed, I will be hanging up here to my colleague Esther. Hello, ma, we can't hear you, please. All right, so briefly, hello, can you hear me?
Hello, can
We
you hear me?
we can't hear you. We can't hear you.
Oh, so sorry about that. I actually don't know that I've been mute. Okay, thank you very much, Ms. Tina. Today we are going to discuss a very important topic, and this topic be saying, know your HIV status, preventing staphylococcus among young people. No be say we go discuss am alone, no. Thank God, as our Martina was just talking about, telling us that we have a doctor in our midst where could tell us how we could take to prevent this HIV, this stuff in our life. So now, before we proceed, I want to say a big thank you to our partners, those who make this program to work, which is PEFA Nigeria, AWDF, Movement for Women, Active Youth for Africa. Thank you so much all for your support on this program. So today we are going to actually, before we proceed, we'd like to introduce our speaker, our doctor, Obaroke Debo is a driving medical endowsis with a frequent dedication to advancing healthcare, particularly in the realm of women's health, with a passion for raising awareness and advocating for the well-being of women everywhere. She is committed to making meaningful contributions to the healthcare industry as the organizing Secretary of Christian Medical and Dental Association in our school chapter. They both combines for leadership skills with a passion for service and collaboration. She strives at the intersection of healthcare and innovation, believing that technological advance have the power to duplicate outcome. Thank you so much, Doctor. Can you just say hi to us before we proceed? Hello, Doctor.
Hi, good evening.
Good evening, welcome. Nice having you here, Doctor.
Thank you.
So we also have Nurse Hoke Caleb. He's a dedicated and compassionate nurse with a strong foundation in nursing science, graduated from the prestigious College of Nursing Science as Martha Miss Collinate Hospital in Afriport, Ebonyi State, committed to delivering high-quality patient care and advancing the nursing profession with the passion for improving healthcare outcomes. And I strive to provide imparts and evidence-based care to individuals and community. Nurse, welcome. Nice having you here. Hello, Nurse, can you say hi to us?
Hi, good evening, all.
You're welcome. Nice having you, sir.
Thank you very much, Esther, for that introduction. And
You're welcome.
thank you, Nurse Caleb. Thank you, Dr. Debbie, for coming on the call. And I want to plead that you pardon our intonations. So, especially in the pronunciation of your name. So, um, we're moving straight to the conversation, and please pardon us, we are going to be moving to pidgin, because we don't want it to be that some people will say that they use big English too much, so maybe we just step down so that we go feel understand ourselves, and our people wey dey hear us outside go know wetin dey sup. So, like we discussed earlier, we'll be starting with knowing what this staphylococcus itself is about, because so many people don dey hear about staph. They go say, how this infection sef still dey exist for body, wetin be this one sef. But we don hear so many people wey get this kind of complications abi health challenge, wey be say they no fit talk to person, but na im be the time wey be say they fit hear more about that information. So abeg, our young people, our women, our girls dem, if you just dey join us, make e dey free to drop message. Today we dey talk about staphylococcus infection. So in case you don hear am before, or you don sabi, you don get person wey get am before, make you lis ten to the information so that you go fit pass am across to them. So our doctor, we start with you, ma. What is staphylococcus infection?
Okay, thank you very much. So, Staphylococcus infections, basically, they be group of bacteria called Staphylococcus. They are caused by bacteria called Staphylococcus, and one that causes illness is the Staphylococcus aureus. Normally, these bacteria, they live harmlessly on our skin and in our nose as part of normal bacteria, as part of organism where they live for our body. However, when the skin they damaged, maybe through cut or injury or cracks or scratch, the bacteria fit enter and cause infection. Sometimes it can be minor infections like balls, but sometimes if you enter the blood and cause
Mm,
overwhelming infection, which fit damage liver, sorry, which fit damage the heart, lung, bones, which fit damage some organs for the heart, sorry, for the
mm,
body.
mm. Thank you very much, ma. That means say the thing they work out for body as organisms. So, because one thing, when we dey talk this afternoon with some people, because we just open line make people share wetin dey disturb them, and the woman also say she dey notice boil for her body, and when she go do test, they say na staff na im dey do am. So by the time she don go do the test now, for test result na e go show all this resistance and everything. So now when this one come be like this, how this woman fit take handle this case? She don buy the medication, she take am, the medication, after she don take finish, e still be like say this thing no go anywhere. Wetin we go do for this matter?
Okay. So concerning the woman that went and she took drugs um and it seemed like the drugs didn't do anything, it's probably because she has a more resistant strain of the bacteria. So basically,
Hello, ma, we lost you there.
like I said, with antibiotics, which are like drugs to like kill bacteria. You said?
Mm. Okay,
Sorry, what did
continue.
you
I
say?
think the light break on the way.
Okay. So
Mm,
sorry about that.
sorry.
antibiotics. That's most likely the drug they gave her. They are drugs basically for killing the bacteria and preventing them from causing further infections. But
Mm-hmm.
since hers didn't go, um, the bacteria which she get for her body, the drug they give am, they resistant to am. The bacteria where they her body get they resistant to the drug they give her. So what they are going to do, they're going to perform a test
Okay.
on her. The
Mm.
test basically is called microbial culture
Okay.
sensitivity test. So basically, this
Mm.
test helps to like identify the specific species because I mentioned earlier that there are different types of these bacteria. Sorry, there are different species of this bacteria. So it's going to identify this particular species that is causing the infection and find an antibiotic that is sensitive, that the bacteria is sensitive to. That means the bacteria is the drug that they give, the antibiotics can treat the bacteria. So yes,
Mm.
that's basically what they're going to do. They're going to find out the drug that will work for the
Whoa.
bacteria by performing a clinical test on her, microbial culture sensitivity test, and MCS.
I see. No skill abeg throw mouth put inside this matter. Shey this staphylococcus thing na curable infection?
Okay. Can you hear me?
Yes, we can. Yes, we can.
Okay. Staphylococcus aureus as a bacteria is curable. So the answer
Okay.
is yes, that it is curable.
Okay.
Uh, but that can only happen when there is a proper treatment in place. So the
Mm.
type of treatment depends on the severity and type of infection, just like uh, the chief here has spoken. God bless you, doctor. So, depending on the type of this bacteria, you understand,
Yes.
will help you to align to a specific type of treatment that you're gonna give this person. Could it be because, as she earlier said, it could start with mild skin infections, you
Mm.
understand, which topical antibiotics can be administered. Just something like there's one of these common drug we use in treating them called mupirocin, you understand, or bacitracin. So these two can actually work. That is for the skin now. So, and when one has actually allowed this thing to, become more complicated, makes it or gives a risk for the cure, for the ability to get cure reduced. You understand?
Mm.
But in a general knowledge, it is curable. But depending on the person who is actually a carrier of this infection, taking the right step at the right time. Thank you.
Thank you very much. So, Dr. Debbie, I beg you agree with that thing wey you just talk now, because you know one thing, person talk say he don take too many medication, he don take all these antibiotics, there is no antibiotics wey dem don refer this woman to wey she never take am. But at the end of the day, now our question again be, shey this thing dey affect conception? So wetin we fit talk about this matter now, because we want make we address some of these their issues wey dey bother them. So you say shey this one now dey affect conception? If e dey affect conception, wetin she go do as a woman?
Okay. Yes, I actually agree with everything he has said.
Mm.
And concerning it cause affecting fertility, conception, it actually does. So I'm coming. So it actually does, because, like I said, there are different types of bacteria. There are different types of organisms in our body, basically. And these organisms, they are basically called floras. They help to like protect the body, basically, from infections. They help to protect the body from different kinds of things. They help to keep the body in a normal healthy state, quote unquote. So in a case where um the normal flora, like for example, I said that the staphylococcus is on the skin, and in a case where it moves to a place where it's not meant to be, it can cause an infection. That's what is happening right now. So it can cause an infection. So normally,
Thank you very much, Dr. Debbie. Thank you
I'm
so
so
much.
sorry. Okay,
Okay, I think
I'm
your
not
line
done.
got broke on the way.
Yes, it did. Okay, so
Yeah.
yeah, so if the Staphylococcus aureus infects the genital tract, like um the reproductive, yes, the genital tract, the reproductive system, or everything during like invasive procedures, maybe like a surgery, or through the use of intrauterine devices, like all these contraceptive devices, it can cause an infection. It can cause an infection, and this can like affect the fallopian tubes. And the fallopian tubes, they are basically, they help to transport um
Mm.
the
Which means a person fit day with staphylococcus, you know, go fit no
yes.
scale.
Yes.
Okay, no scale abeg. I want to chook mouth inside this matter. Now, for instance,
Okay.
say we dey talk say the thing na disease wey dey for skin, e dey show for skin say I come as boil o. But now e come dey affect pikin wey suppose come out from womb. So does it mean that the woman wey don carry belle already, wey come get staph, say im pikin too go get am?
Okay. Yes, there's possibility. There's a high risk that the woman, that the baby can actually contract Staphylococcus aureus, or not only that, every other infection which the mother actually is a carrier of. Reason being that um, the woman shares directly with the baby, and not just that. Secondly, at the course of delivery, maybe in surgery, maybe the use of some devices can actually cause fluid to fluid contacts, and some exchange of fluids. So there's possibility, there's high risk, about 70%, if I'm to say, that the baby will have uh, this infection, especially during child delivery, because if the baby escapes the infection at every other period in time, during child delivery, there's possibility that the baby will have it, because at that point now, the baby cannot escape those fluids at the cost of escaping the uterus. Thank you. So,
Thank you
and in
very
addition,
much.
in
So,
addiction, in addiction,
okay,
that it is that the disease affects the
okay.
skin doesn't mean that it's actually originates there. It manifests as the skin. You understand now? It manifests as the
Okay.
skin, but it is a reproductive based infection. Are you getting it now? So, but its manifest now is in the skin, is in the throat, is in the nose, and some of these bacteria can actually live there, but still you contract it in other aspects too. Okay, just like example too, it can maybe, if not treated, it can cause endocarditis. So you
Hmm.
cannot say now that it is there. It is not there, but it is a complication of the disease. So I know you wanted to ask me what endocarditis is. Endocarditis is just, when you talk about endo, is in, the cardium is the heart. So the carditis, we are talking about the inflammation. So causing different cardiac infections, cardiac diseases. That's what it means. Thank you very much.
Thank you very much. So, Dr. Debbie, so this pikin them, the day as in very at a higher risk of even contacting the infection past even adults, Abi.
Yes, yes, they do.
Okay,
Can you
so
hear me?
yes, we can hear you. Thank you very much for
Okay.
that. The thing be say, the thing where they baffle me be say, we from all indications, it has been proven that this thing no be, sexually transmitted infection. But then now, waiting cause this staphylococcus if no be sexual intercourse, because something must dey involved before that thing go happen. Abi e just dey come form itself inside the person body.
Okay. So, staphylococcus, like I mentioned earlier, it occurs like, let me just, it comes from like two sources. There's like an endogenous source and there's like an exo, like from outside and from inside. Basically, from inside, it's living on your own body. So it's just staying there without causing harm. I've mentioned this before. But if your immunity like drops, like your immune system is for the system that basically fights infections in your body and everything, or your skin is broken, like I mentioned earlier, through an injury or cuts, it can seep in because that's not where it's originally meant to be. It begins to cause problems there. Then from others outside, from the outside source, it can be due to coming in contact with an infected person through handshake, through hugs, or it can be due to touching contaminated surfaces, coughing. It can be due to like, because it's contagious, it can be due to, it can be gotten through coughing or sneezing. And basically the key part of this thing is that there must be a break in your skin barrier, or even your mucus. So if it touches your mucous membrane, like for example, you touch the a contaminated surface with this bacteria, and maybe just you unknowingly you put your hand in your nose, in your inside your nose, you have automatically introduced it into your system. So it's like through direct contacts, indirect contacts, and by um airborne contacts or contamination. Thank you.
Thank you very much, Dr. Debbie. That's answer dey very very understandable. So I believe say thank you, Dr. Caleb, to Nurse Caleb, for this information wey we dey pass out. So for our women and our girls, our young people wey dey outside there, if you just dey join us for this section, make you dey free, make you drop your question, and of course we go send and give these experts and they go attend to am, so that you go get all the needed information when you need wey concern your health. So you no just suppose end with staphylococcus alone. If you get more other health complications wey you need say this problem, you need person wey you fit talk to, and you no fit talk to anybody anyhow, abeg make you dey free to call in or drop your message. So we go move. Madam Esther, please mute your mic. Mute your mic.
Okay.
Help us move to the next slide, please.
They change it. All right, thank you. I've done that. Thank you, doctor, for opening your camera. Please,
All
nurse,
right.
can you please open your camera also? Let me see your handsome face. See my doctor, beautiful face. Welcome, ma. So our next question, why is this infection like staphylococcus getting more dangerous and harder to treat or combat? Wetin we say, why this sickness can be so difficult for For some people, like the way my colleague just said, like some women, they ask questions, say they take the antibiotics, and the antibiotics the sickness no want to go. Now, this question be say, why this sickness be so dangerous that you no want to hear the treatment where then they give them? Abeg, doctor, can you just throw more light on it so that we can understand the reason why the sickness no want hear the treatment?
Okay, thank you. So for some bacteria, they just have a genetic mutation, like something is in them that prevents them from answering to that specific antibiotics you are giving them. While some, it can be due to overuse, like I'm having cold, they will go to pharmacy to get antibiotics. I'm having sore throat, they will go to pharmacy to get antibiotics. So over time, the bacteria becomes acclimatized to the antibiotics, that it doesn't work again for them because they have been taking it for the slightest things. And also, it's also as a result of the fact that for example, like most of us, because we don't like taking drugs, when we are fine already, it will be like, oh, I'm not taking it again. But there's a reason the doctor gave you a specific time frame to use that antibiotics for, because not using it throughout that period, like, makes the bacteria more resistant to it. So we have to finish our medications when the doctor said we should finish it. Not like, oh, I'm already fine, I don't need it again. The doctor gave you that specific to use it for that specific time frame for a reason. So these are like the three reasons why it's getting more harder to treat. So because of overuse, the bacteria becomes like acclimatized to the antibiotics. So when it comes, like, it doesn't work on me anymore, then not finishing your medications, it makes the bacteria more resistant to the drugs. And also, like, some of them are just not in that particular antibiotics can't work for them. Thank you. Hello, please, can you hear
And
me?
Sister, we can't hear you, please. On mute.
Okay, sorry. I said, no be lie, oh. Some people, when they immediately they just take the medicine don't dey okay. They don't dey okay small. They say, me, I don't find, there's no need to go take the medicine again. Some of them, they continue taking it, and before you tell them, they will say, the thing not come, they work again. No be lie. And then you also hear from the nurse. Nurse, can you say anything? You have anything to add to it? But please kindly open your camera. Thank you. Thank you very much. So do you have anything to add to this? You are muted. You are muted, nurse.
Okay. Why is infection like staphylococcus getting more dangerous and harder to treat? Okay, or combat? Yeah, it's difficult to treat based on how, and it's still a matter of how the person tried getting the treatment, or how the person actually decide to go about it, in the sense that you may feel somehow, you notice the rash, you notice the wound, you notice something, fever, or you are feverish. You also want to seek for medical attention because you knew that paracetamol can actually be used for a fever. You go there and take it, or have it over the counter. Then sometimes you also think, okay, because you're having wound, it's just normal, let me go and do this and that. You will keep on buying one or two antibiotics, buying different analgesics, buying different things. Before you know it, this sickness will actually create a very high bond, you understand, to resist many antibiotics and many drugs that could have been a first line or second line of treatment to you if you the person had actually gone to the hospital to seek for best medical attention. But without that, that is why it seems dangerous or harder to treat. You understand? And sometimes, even when you are done treating them, it will still come back. Reason being that if not well treated too, it will still come back because it will do some. It will be like as if it is being encapsulated. It will just encapsulate
Mm.
the bacteria. So the bacteria, it will just be like as if you have a ball, you are just pouring water or you are throwing a stone on a ball. You just throw it and it will bounce back. Throw it and it will bounce back. When it notices that nothing much is actually coming back again, then it will now envelop itself again and still manifest. That is after a few months of but 3 months ago I treated this thing now. Yes, now it is back again. That is how it,
That's all.
thank you.
It is great.
So,
I beg, let's just take this last question where they just sent for us today. They said the woman say, "Is it normal to get staph infection often? I get them frequently. I never know that na big thing until but e dey come, e dey go, e dey come, e dey go. I dey see am like normal thing. Abeg, shey na normal thing
It's
to get
it's not
staphylococcus? Abeg, na the question be
it's
that.
not a normal thing. I think that's just what I answered last. Hope I'm correct. The answer I gave last, the statement I made last, answers this question. I hope I'm there.
yes, yes,
Are you
yes.
are you with me?
Yeah, yeah, we can hear you.
Yeah, thank you very much. Dr. Debbie, do you have any contribution to that?
Okay, yes, I would like to add some things. So for the fact that she
Okay.
keeps getting frequent or recurrent staphylococcus infections, they are like some, it's actually not a normal thing, like Caleb said, but there are like some things because hygiene can also be poor hygiene can also be the cause. So she should avoid using contaminated towels, razors, or she should check maybe she's like in close contact with someone that has it. And maybe her immune system, she should try to boost her immune system by taking fruits, vegetables, vitamin C. And she should also avoid the use of frequent antibiotics because if, for example, the staphylococcus that is like infecting her is resistant, it will keep coming back. It will keep coming back. So she should also go and see a doctor. Yes, she should go and see a doctor because actually not a normal thing. Yes.
I
Thank
see.
you.
Thank you very much. Thank you everyone for that beautiful input. And to our people out there, I believe say with the discussion where we don't get today, we don't learn plenty things from here. We don't attend to those questions when we not send. We they wait for more. Of course, even the ones where still remain, I just see some where does they drop so, but we know if we take them now because of our time. But no worry, we go treat them next week again. So the same time, make you try join and call your brothers or sisters. Then make they join the program together with us. May they follow us and he ask all the question where they concern their matter. So before we go, we want just say thank you to our amazing partners outside there. So to other people where we say that they listen to us and say you like the program what we they do, I beg. Also, don't forget say don't forget us for your plan for your budget so that you go join chat for health every time. Make our people feel they get all the necessary information wey go help them stay healthy. And then so for you woman wey be woman, man, pikin wey know say your health needs never you never get all the needed informations wey you need, and the time to always chat with chat for health build. If you know say dey free to communicate with people outside there, chat for health build dey available wey be say you fit reach out to, and then you get all the needed informations wey you get, because that one na automated WhatsApp chat build wey be say you drop message, you go get answer instanta. And then no forget, if you drop any result, our doctors, our nurse dem, they dey available, wey be expert for this field, wey be say they go interpret the matter, and they go give us all the solutions wey we need as women, as people wey fit help us to manage our life, and we go come dey healthy and live long life. So abeg, make you no forget, we go meet again next week Thursday. So make you no forget, we go call the number wey you fit call, reach out at any time. The number na 070 480 65486. Sorry, another one na 080 480, make I take am jeje so that we go hear. 070 480 65450. The first one wey we take na 070 480 65486. So the Chat for Health Beauty number dey available. Madam Esther, carry us go the first screen. May we show them the number where they fit reach out to anytime, any moment. May they fit chat with Chat for Health Beauty. Abeg, first slide na we wan see. Okay, so as e be so, in case you never get all the information, so we will say dey available now when we dey do the discussion, and you feel you wan ask question, you still get question wey you wan ask. Abeg, make you call, make you chat with Chat for Health Beauty, get the information. The number na 080. Abeg, you dey close to your pen, abi? Alright, so we go take am now. The number na 080 08069423539. I go call the number again. 08069423539. Now the number where you fit chat with the Chat for Health Beauty be that. You go get all the instanta message, they go reply you when you drop am. So no forget, this Chat for Health na program wey be say na for me, na for you, make e meet all our health needs wey we need. So no dey shame, no shame, ask question so that you go get the solution for that thing wey dey disturb your health. So we want to say thank you to our amazing partners again for their support, and we know say they go continue to dey push us make we do better. So PayFar Nigeria, we say thank you. African Women Development Fund, we na thank you for being our backbone. And then we want to say special thank you to our guest today. Thank you, Dr. Deborah, and thank you, Nurse Caleb. I want to also say thank you to my colleague Esther. Thank you for coming. And say next week Thursday again, we go fit yarn the matter again as it dey be. So abeg, when we dey connected till we meet again, next same time next week Thursday. Bye.